Welcome back to Aesthetics Magazine. Discover more skincare resources at aestheticsmagazine.com. In this episode, we are going to talk about sunburns. A sunburn is a radiation burn that affects living tissue from an overexposure to ultraviolet radiation, usually from the sun, which can also be produced by tanning lamps or welding arcs. Usual mild symptoms in humans and animals are red or reddish skin that is hot to the touch, general fatigue, and mild dizziness. Sunburn can occur in less than 15 minutes and in seconds when exposed to non-shielded welding arcs or other sources of intense ultraviolet light. Darker-skinned individuals produce more melanin and are at lower risk, but are still susceptible, especially to excessive exposure. It appears that some genetic factors have been identified, therefore heredity, skin type, and male gender have been identified as risk factors for sunburn. The redness is caused by engorgement of blood vessels, which give the skin the characteristic red or pink appearance of the burn once it has become apparent. This is caused by the dilation of endothelial cells, leukocytes infiltration, and erythema mediated by B and T cells in the subcutaneous tissue in addition to vasodilation. After the burn has subsided, skin peeling will occur, hence peeling is the body's way of getting rid of the sun-damaged cells and making way for new cells to grow. This happens because the body is trying to get rid of the cells that have been damaged by the sun. The DNA in the cells has been damaged by the ultraviolet radiation. Most sunburns are mild and can be self-treated at home. However, a number of sites on the internet give various folklore remedies which have no proven effect. In severe cases, hospital treatment might be required. The final level of sunburns is called 4th degree, which means the burn exceeds the skin and fat. It may destroy the muscles and even expose the bone. Obviously, this is a life-threatening condition, therefore, the patient needs immediate transfer to a trauma center for surgery and wound care. 4th degree sunburns are usually caused by the intensified UV radiation in high-altitude areas or a serious scalding. 3rd degree sunburns are severe and may cause long-term skin damage, even exceeding the deep skin layers and involving the subcutaneous fat. Many vascular damage and hardening processes of the fat will interfere with the normal heat dissipation, which will lead to hypothermia and heat stroke. Unlike other sunburns, 3rd degree cases are frequently painless because the nerves have been destroyed. Immediate medical attention is required in all cases of 3rd degree sunburns, and it may need continuous wound care and physical therapy for functional tissue restoration, such as skin grafting or debridement. 2nd degree sunburns involve the deep skin layers and cause blistering, whitening, or dermacoagulation. They often are extremely painful, and there is fluid loss from the burn area. Combining with a moderate fever and hypothermia, the healing will take at least a few days, and scarring is possible if the wound is infected. Studies show certain rarefied 2nd degree sunburn can heal by itself, however, most times it needs immediate wound care to prevent infection. 1st degree sunburns are the mildest and involve redness and a bit of swelling. The top surface of the skin has been damaged, but the skin is not blistering. The erythema may not be evident for a few hours and progress for about 24 hours. There are no long-term damage with 1st degree sunburn, but the risk of skin cancer increases according to scientific research. The first and most important thing to do in treating a sunburn is to get out of the sun and preferably cover up the affected areas to prevent further exposure. Hydration is key, and it's important to drink plenty of fluids. Aftersun lotion can also be applied to soothe the skin and encourage the natural healing process, but avoid using greasy or oily products as these can clog the skin and make the symptoms worse. If you start to feel unwell or the skin begins to blister and swell, this could be a sign of severe sunburn and medical advice might need to be sought. In the longer term, it's important to stay out of the sun and protect the skin from further damage. Wear loose cotton clothing that allows the skin to breathe and a wide-brimmed hat to shield the face and neck. Sunglasses with UV protection can also be used to protect the delicate skin around the eyes and to prevent eye damage. When the skin has fully healed, be extra cautious about using sun lotion or oil with a high SPF and ensure that the skin is properly protected from the sun's rays. This will help to prevent the risk of long-term damage and skin cancer, as well as avoiding the discomfort of another sunburn. Discover the natural power of vitamins with this new book, Understanding Vitamins in Skincare by Greg Rishaw. Learn how vitamins can nourish, protect, and renew your skin, all while embracing a healthy, balanced approach. Get your copy today and uncover the secrets to natural ingredients. Understanding Vitamins in Skincare is available now on Amazon.com.